To understand and address women's uterine health burden, the Commissioner, Niger State Ministry of Health, Dr. Murtala Mohammed Bagana, has hosted a civil society organization to enhance sustainable health and outcomes for women. The commissioner received the Uterus Health and White Ribbon Alliance Nigeria with a promise to strengthen the partnership with them to achieve the set goals. This visit took place at Ministry of Health Conference Hall, Minna. The reports.
African women's menstrual and reproductive health remains under-prioritized, largely because it's under-researched and under-measured. It was against this background that the Commissioner, Niger State Minister of Health, Dr. Murtala Mohammed Bagana, deemed it imperative to partner with White Ribbon Alliance Nigeria and Uterus Health as a state's commitment to evidence-based policy making, as their role is to position the state as forward-thinking action, oriented and committed to improving health outcomes for all citizens, especially women who have been underserved.
If you are looking for what truly partnership represents, I think this is exactly what we did today around women's health. I think the cries and the lack of care around what truly matters to women, policymakers, government have truly not paid attention to women's health. And like the literature says, women's health is a spectrum of entirety of on a day-to-day, especially women of reproductive age. They are coming today is to kind of give a brief of exactly what they found out from the field. There is a womb index project that requires that the field test the tool, and after that properly into the field to carry out a proper research. And what ultimately the research we do is to come up with key decisions that will help, whether it is menstrual pain, whether it is fibroid, whether it is endometriosis, whatever women goes through in their silent moment and also in the public. This study, this research will be able to help us as government and as policymakers to finally put on the table some concerns that women have been raised for quite some time now.
On her part, the founder and CEO of Uterus Health, Dr. Foxuwori, maintained that Uterus Health care about women across Africa, and this necessitated them to join forces with White Ribbon Alliance Nigeria as well as Niger State government to translating women's life experience into effective policy action.
Well, Uterus Health is working very closely with White Ribbon Alliance that I know all of you know. We know that we're joining forces with them to really amplify and drive early, accessible, dignified care for women. That means focusing on uterine health. The work that we do starts with women. You know, we're very glad that the federal ministry, that the High Commissioner of Health for Niger State has also committed to joining forces, because at the end of the day, government has to own this in terms of how we think about women's health. For every question you care about, every question and curiosity you may have asked Honorable Commissioner, Uterus powers that very importantly. It is our core business model. We started because we care about women across Africa, and Nigeria is a big part of it. And we cannot do this without our partners at White Ribbon Alliance as well as the government. So all of us are part of reshaping how we focus on deprioritized, under-resourced, stigmatized conditions around uterine health. That means the womb. That means heavy menstrual bleeding that leaves women for days on end not going to work or feeling sick and having pain. It means fibroids, it means adenomyosis, it means endometriosis, it means all these polyps, all these conditions that and our systems don't capture. That is what we focus on.
Also speaking, the founder and executive director, White Ribbon Alliance Nigeria, Chief Tonte Ibrahim, said women's health is a right, equity, and development issue that affect families and communities.
We are coming here to bring the issue of uterine health to the government and people of Niger State. We are starting with the research, which is pilot testing the tool that will be used to diagnose heavy menstrual bleeding and other uterine conditions. So the research is taking place in about 6 states, and Niger State is one of them. But for the pilot testing, we are testing in Rivers and in Niger State. And so we are very excited that the Niger State government is not just committing to being part of it, but also taking ownership of the process. As White Women Alliance, as a civil society organization, we look forward to seeing government take actions, especially on the outcome of this research.
Ahmed Yusuf, reporting for Finest TV News.